Yeah, Steve Wolverton, physician from Indiana University, Department of Dermatology. I'm the Theodore Arluck Professor of Clinical Dermatology. I've been there 21 years and I've enjoyed it immensely. Average book of this nature has about a 5-year lifespan. Typically I prefer a 6-year turnaround. The company seems to prefer a 4-year turnaround, so we average it out to about 5. But it has to do with just the number of new drugs coming out. Biologic therapy, for instance, for psoriasis, now is expanding to hidradenitis and other diseases. And with the simple evolution of that, the first book with comprehensive dermatologic drug therapy title had one brief chapter. The second edition of the current title had 2 different chapters on biologics. Now it's increased to 3 chapters. The last book had 60 chapters total. This current edition will have 70 chapters, trying to reflect new drugs and new approaches for older drugs. One of the interesting new chapters is both from a side effect perspective and from drugs that dermatologists would use would be drugs that are traditionally thought of as chemotherapeutic agents, and when do these drugs apply to either a dermatologist prescribing them or co-managed with an oncologist. All of them have guaranteed hard to pronounce names: vismodegib for basal cell carcinoma, and ipilimumab, and vemurafenib for melanoma. And so we're trying to get a reasonable representation of these drugs. Even if somebody else is prescribing them, we at least know what to follow as our patients are managed by the oncologist. This particular book has fit my personality as far as my organizational interests. There's just way too much to know, and I've always been interested in how do you condense that. So the goal has always been to find something where you can get a very concise reference. Well, the neat thing is that there's still no Me Too books of this nature. All the drug therapy books other than mine tend to be disease-based, whereas mine is a drug-based book. And so it's very gratifying to see that it stood the test of time over 20 years as still a standalone title that people just can look up, find solutions for problems, and even better now with the electronic aspects. Before I had any name recognition at all, a company called Grun Stratton had started a book series, Drugs for the Heart, Drugs for the Lungs, and then the third one was going to be Drugs for the Skin. And they had asked a family, 2 authors, the Shelleys, who asked my current chairman at that time, Arnold Schroeder, who asked me, who realized that I had to have somebody of bigger name recognition to have the book. So as Grun Stratton turned to Saunders, I asked John Wilkin, who eventually became the FDA Derm Director, to be my co-editor, and then I went solo from then on. But it was a natural progression from Saunders to Harcourt's Health Sciences to Elsevier. But as I've done that, no doubt they have the copyright for the printed material, but also just every single editor I've worked with has just been very good at just making sure the needs are met, make sure that various people get their chapters in on time, make sure it's well displayed in the print version. So, you know, I've basically grown up as the company's gotten bigger, as different companies have bought each other, and they've been good to me, so I'm glad to keep staying with Elsevier.